Welcome to 50 Plus in Montgomery County, a monthly program that is a voice for many, produced by the Commission on Aging, of which I'm a community member. This show is insightful for people of all ages, and each episode takes a fresh look at important issues by spotlighting older adults in the community, representatives of services and programs, and activities of interest to older adults. My name is Katie Smith. On this month's show, we're going to talk about Latino health. Joining me is Ingrid Lizama. Ingrid is the communications manager for the Latino Health Initiative, or LHI. Hi, Ingrid.
Hi, Katie.
How are you today?
I'm doing well, thank you. How about you?
I'm doing well and I'm excited to talk to you. Let's go ahead and jump right in. Ingrid, tell us about the Latino Health Initiative. What's the story behind how you came to be?
Of course. Well, the Latino Health Initiative sits within the Department of Health and Human Services of Montgomery County government. We are one of three minority initiatives within the HHS. We serve our Latino community living here in Montgomery County. We have been established for a little bit over 24 years, serving our community with programs related to health in Spanish.
Now, Ingrid, how large is your team?
So the LHI is made up of 15 county employees. We have staff that represent a lot of Latin American countries, as well as a coworker who is from Ethiopia. We are serving a lot of the Latinos, as I mentioned, but we also have one particular program that is open to all the residents and serving a lot of Ethiopian community members as well. So we are a team of 15, ranging from countries like Mexico, El Salvador, Argentina, Chile, Costa Rica, Guatemala. So we are pretty diverse. We have some other colleagues too. I don't want to forget to represent their countries as well. We have Bolivia and Peru as well. So we are a pretty good team that represents a lot of our community here in Montgomery County.
Wow, that's great. And I'm sure that also contributes to the broad reach that you have in terms of your impact.
Correct.
With that in mind, tell me what types of service programs rather, and activities do you offer?
Of course. So the LHI has various programs. We have a couple of them that we work with the school systems. We have an asthma management program that focuses on managing the asthma of the kids who are primarily in elementary school. We have a program called the Welcome Back Center Initiative. This is a program that assists foreign trained health professionals, nurses, physicians, psychologists who are living now in Maryland and want to re-enter the work field in health. We assist them in helping them get the accreditations that they need, the English proficiency, and how to navigate that system so that they can go ahead and get that certification to work again in the field. This is open to all Marylanders who have been trained abroad and want to do that type of work here in Maryland. We also have a Latino Youth Wellness Center that assists middle schoolers in learning leadership skills and also how to take care of themselves. And by that, I mean by their health, engaging them in physical activity and learning about health education. We partner with Identity Inc. to be able to deliver this type of programs at middle schools. We also have another one related to families, which is the Family Reunification Program that targets and assists recently arrived youth and their families to build up a communication within their family so that they can discuss different topics and focusing a lot also on mental health so that the time that they were separated, they're able to talk about it and become a family again. We also have a mental health services that focus on encuentros, which in Spanish is called encuentros. In English, it would be encounters. These are mental health community groups that meet up once a week to talk about mental health. And this one came right after COVID-19. It focuses on building resiliency and also learning new coping mechanisms and how to also seek assistance from professionals. I know that there's so many programs that we have, and I'm briefly mentioning them. We have a case management service that pretty much focuses on connecting community members with the resources that they need. We have a health promotion and outreach team. These are called promotoras, health promoters. They're the ones in the community providing information to our community members, meeting them where they are at, providing them all the essential information that they may need to access healthcare, to access programs, to access our programs as well. Sometimes people in the community may be seeking a service, but they don't necessarily know how to get to the Department of Health and Human Services. So we're meeting them where they are at, providing them pamphlets, providing them links, phone numbers so that they can get connected. We also have a systems and navigators and interpreters program. This program in itself assists those who need connections to the county services. It's similar to 311, with the exception that they have also resources in Spanish, in English, and in French. And this helpline sits within CASA, which is a community-wide organization that a lot of our community knows. They can call that number and they can get assistance with connections to the resources. And they also offer a interpreters program that if you call, that you need interpretation for a medical appointment, they're able to get someone to assist you, especially if you're a customer or a client, I should say, from the Montgomery Cares program, which is a program within Montgomery County that assists uninsured or low-income families to access health care. We also have a climate and health education program that focuses a lot on climate health, how to take care of the planet, how to take care of yourself as well, taking care of the nature that we have. We do a lot of amazing programs within that initiative. We do forest bathings, we do Zumba outdoors, and we also focus that on connecting people with resources, and especially with the Department of Environmental Protection. We also have a new program that's called the Community Health Workers Certification Training. This is a new program that we recently added to the LHI. We have been accredited by the Maryland's Department of Health to be one of the institutions to provide this type of trainings to people who want to become health workers. And we deliver this program in Spanish. So we are one of the very few within Maryland to do this type of services in Spanish, and the first here in Montgomery County to be able to provide those services to the community. There's a lot of people who are very interested in becoming health educators, health workers, helping out the community understand how to better take care of their health and how to engage with the community in such an amazing way, whether it's talking to them, whether it's hosting Zoom calls, doing a lot of education in various ways so that the community stays informed and continues to stay healthy. And that's just a little bit about everything that we do. And lastly, we have the communications initiative or program that just focuses a lot on making sure that the community is up to date with a lot of the information that the county is releasing. We have various social media channels, which allows us to stay connected with the community through online channels and making sure that we are answering their questions and having that connection and community with them.
Ingrid, that's a lot, but a lot of great programming. I'm curious though, let me follow up just a little bit. If I'm new to the area and I want to learn more about LHI. Would I get that, through the health promoter? Would I likely see it on social media because it came from your communications department? Um, and they told me about, I'm going to get, hopefully I get this right, in Quintos, about the mental health program. Like, tell me a little bit about what that process is like of reaching people for all of the great programs that you have.
Of course, there's different ways to get the people connected to our programs. One of them is the health promoters. They do such an amazing job of being out in the community, whether it's community events, back to school fairs, or just, hanging out by the supermarket, the Latino supermarket in the community. They go to laundromats, they go to churches just to pass information. So it really does depend on the area you live, but most likely there's always a group of health promoters there. You'll see them with their branded shirts, and they're handing out flyers, or they're teaching people also how to scan QR scan codes, which are so popular now. Sharing with them the phone numbers of the helpline so that they can also get connected. We have to keep in mind that there's different people in our community that like to communicate differently. There's people that like that face-to-face interaction. There's people that really enjoy just having to text someone to getting information, and they receive the flyer via WhatsApp, or whether it's via Messenger on Facebook or Instagram. And then there's also people that really like to just pick up the phone and call someone. So
Mm.
the helpline, the health promoters, or our social media platforms can also get that person connected to the services.
Very nice. Now, the Latino Health Initiative, y'all have received a number of awards, news mentions, and highlights because of your great work. Can you talk about them?
Of course, we're so excited that our work has been recognized. During COVID-19, we started the initiative Por Nuestra Salud y Bienestar, which means for our health and wellness. This was an initiative just during COVID-19 that covered a lot of basics for our community, whether it was testing and vaccination, whether it was case management, that mental health component as well. We also did a lot of work with the health promoters out in the community. And we did a lot of work with communications. We wanted to focus a lot on preventative health. And with that, we created an entire campaign with a character that we developed with our consultant. Her name is La Abuelina, which is also translates to English as the grandmother. There's a whole story behind her, but she's a Salvadoran grandmother who teaches the community members here in Montgomery County in Spanish about preventing getting sick from COVID-19. And as the pandemic went on, educated the community members on testing, on vaccinating, the importance of getting the booster shots, and just keeping the community engaged via different communication channels. In those videos, as public, as PSAs, won a couple of Emmys, four to be exact, over the course of 3 years. We have been very grateful for the opportunity to win those awards. It was definitely a group effort, but it also highlights the importance of getting messages across in the language of our community members, and also doing it in a way that resonates a lot with the community. The reason why we chose a grandmother figure was because the grandmothers within the Latino community are known to be wise, and they're that person that you listen to. But also because our focus groups that were held here in the community also pointed us to the right direction of making a character of that importance. And now La Abuelina is trademarked and belongs to Montgomery County government.
I like that. How are your middle schoolers engaging with La Bolina?
So the cool thing about the abuelina is that, we couldn't just stop at the grandmother. We also had to develop a different character to be her husband, Don Carlos, who we made Afro-Colombian, just to also educate the male community within Montgomery County to get vaccinated, continue to take care of themselves. So we were thinking about reaching the male audience as well. And then once the COVID-19 vaccine was available for the teenagers, we made a new character. His name is Alex. Alex is the grandson of La Abuelina and Don Carlos. That's how we kind of started to engage with different audiences. And once the vaccine was available for younger kids, we also added one more character to our family. Her name was Valentina. Valentina was a 90-year-old girl who liked being on her phone, liked to be on Zoom. And we really wanted to capture the essence of a Latino family. A lot of the Latino families are multi-generationals, and so there's a lot of sharing time between grandparents and their grandkids. And we wanted the community to also resonate with them, but at the same time learn and get educated when it came to a lot of the COVID-19 information that we were releasing.
Now, you have a great presence in community, but I'm curious, who are your specific partners and collaborators?
So we work a lot with partners that are in the community from our programs that I briefly mentioned. Some
Yes.
of those are being delivered by our different collaborators, one of them being Identity Inc. They have been doing our Latino youth and wellness program as well, our family unification and also the encuentros, the mental health components. We also work with Proyecto Salud, who is part of Montgomery Cares. We want to emphasize that, we are working with different people to make sure that we are meeting the needs of our community. So I mentioned too, the helpline, our 301-270-8432 helpline sits within CASA as well. So we work with them to make sure that, all the information is relevant. They have um, the guidelines, the resource guidelines that we have to make sure that they're connecting our community with all Montgomery County resources. But, we also keep in mind that we are within such a short distance as well with PG, with Prince George's County. And some
Mhm.
of our community members, they also call the helpline to get information. So it's such a great way to maintain relationships with our nearby county and get those people the resources that they also need. So we try to work with a lot of our community-based organizations. We are currently planning our annual Ama Tu Vida Health Fair and Resource Fair. And we work with a lot of community vendors, inviting them to come and table at the events, offer their services, whether they're health screenings, whether they're demonstrations. There's so many great organizations working for the community, and we want to continue to engage with them and collaborate with them to be able to join forces and continue to serve our community.
All right. Well, I hope that you invite the Commission on Aging to that health fair. We'll talk more about your events a little later. How can we improve access to care for Latinos in Montgomery County?
So the blueprint, it's a document that the Latino Health Steering Committee worked on. I believe the current blueprint right now goes up to 2026, which we're not too far away from. So I know
Right.
that they're going to be working on a new blueprint to access, to connect the community members with access to healthcare. We want to continue to work on making sure that the community gets connected. Especially accessing healthcare in their language. That has been something that we continue to advocate and push forward. A lot of the programs nowadays, they're still in English, but there's a lot of access to them in Spanish, whether they have staff that speak Spanish, whether, the flyers or the pamphlets, the information that they're passing out, they're also bilingual. We want to continue to make sure that our community has all this information in their language so that they make informed decisions, especially when it comes to their health. So that also impacts the outcome of any situation that they may be facing, but primarily We want to continue to address the social determinants of health, emphasizing the importance of preventative health. We want to continue to make sure that we are also putting out programs that are of the need of the community, especially since the health programs that the Latino community may need may not necessarily be the same ones that the Asian American Health Initiative is doing or the African Health Program is doing. So we want to continue to make sure that we are addressing all those different topics, from health promotion to healthy eating to physical activity to mental health. So we are pushing forward to continue to work together with other initiatives, but also with our community to learn more about what they actually need.
Wow, you already answered my next question because I was going to ask you about culturally and linguistically competent services, but certainly you're prioritizing that. Now, and my last final questions, few questions rather, how can the Commission on Aging collaborate with the Latino Health Initiative to enhance your programs and activities to address Latino needs?
Certainly. So I also sit as the liaison for the Commission of Aging. We have been very privileged to sit on those meetings and also hear about the wonderful work that the Commission of Aging is doing, learning about different programs. And one of the things that we are collaborating with the Commission of Aging is, all the information that we get from those presentations, from those meetings, we are sharing them with our community members, with our health promoters. We have a amazing bilingual community resource guide where you can find programs and services that serve older adults. We also work with our health promoters to do healthy eating sessions at senior center, especially the holiday senior center that's within the center of our community members. There's a lot of Latino community within the area of Rockville and in Silver Spring as well. So we want to continue to learn more about the programs, to the different programs that serve seniors living here in Montgomery County. And one of the amazing things that we have also done is we were able to nominate one of our health promoters who for the past 23 years has been serving the Latino Health Initiative as a health promoter. She's a volunteer, and she won the Commission of Aging's Community Award of a Lifetime, I want to say it's called. And I want to highlight her work. Her name is Elva Halding. She, as I mentioned, is very passionate about educating the community and accessing healthcare services and programs. And she really likes being out in the community and teaching people about preventative health, about HIV, about climate health. She's such a great person to work with, and we look up to her for her volunteering work that she has done with LHI and with other partners in the community as well. So we're always looking forward to continuing to learn and collaborate with the Commission of Aging.
Thank you for that. We are happy about our ongoing partnership. Now, you mentioned the health fair, but do you have any other upcoming events aside from that? And then with the healthcare fair in mind, what's the registration like? How would people know that it's coming up?
So the Ama Tu Vida, which it translates to Love Your Life, health fair, resource fair, is going to take place on October 6th, which is actually a Sunday. It's going to happen at downtown Wheaton, at the Marion Fryer Plaza, which is close to the Wheaton Mall. It's close to the new county building, and we are going to be hosting that resource fair with a lot of health vendors. We have a little bit over 49 health vendors registered at the moment. They're looking forward to coming and connecting with the community. There's going to be information in both English and Spanish, and we're doing this in conjunction with other departments of Montgomery County to host what we're calling it this year, which is the first of its kind event, the Hispanic Heritage Month celebration, Ama Tu Vida, Ama Tu Herencia. Again, Sunday, October 6th from 12 to 5 p.m. There's
Mm.
going to be free parking. There's going to be entertainment. There's going to be a kids area. There's going to be music. There's going to be also Zumba. There's going to be a lot of different things, food. So please feel free to come. We will be posting that information on our website next week, and we're going to start promoting it. You'll get to hear a couple of radio ads, especially in Spanish, and you'll see them also on the buses. So we are working on getting all those communications out so that you have all the details, but we will also be sending them to the Commission of Aging so that they can also share that information. So feel free to also message us just to get the details, but we are moving that plan along, and that celebration is coming up to celebrate Hispanic Heritage Month. So we're very excited to just spend some time with our community members and learn more about different resources and just be there with them.
Wow, I think I want to come to that, especially to participate
Please
in
come
that
through.
Zumba part. Now, do you have a newsletter at all? And also how can we stay in contact with you?
Yes, so we do have a newsletter. We are currently sending newsletters via Gov Deliveries. You can sign up for them as you've signed up for different things. I hope you guys have signed up for Alert Montgomery. And that way you guys are staying in touch with different departments of the Montgomery County government. You can sign up via them via that route. And you can also stay in touch with us via Facebook and Instagram. I personally like Facebook a little bit better, but again, we are learning different ways to communicate with our community. But we're also staying in touch with others via Instagram. It's been such a great journey as the communications manager to learn about our different audiences in different platforms. We
Mhm.
have also started to, since COVID-19, continue to work on our communication efforts via WhatsApp. There is a Latino Montgomery County WhatsApp group that's run by Montgomery County. The phone number is 240-447-1862. You get access to that WhatsApp account just by sending hello, and they'll sign you up for it, and you'll start to receive a lot of communications from the county on different programs, different resources in Spanish, but also reach out to MC 311, who also has a lot of that information. We always look forward to communicating and addressing any questions that the community may have. There's also within our website, which is lhiinfo.org, a section where you can submit a comment, and we'll get in touch with you within a day so that you can have access to any of the information that you're requiring.
Mhm. Ingrid, thank you so much for taking the time to speak with me today. I've enjoyed our conversation.
Oh, me too. Thank you so much for allowing us to share with the community members a little bit about the work that LHI is doing for the community. We look forward to staying in touch with you, with the Commission of Aging. And if you guys have any questions, please feel free to reach out to us via Facebook, via Instagram, via the website, via the WhatsApp, or send us, comments with the health promoters when you see them out and about in the community.
I'll be sure to speak when I do. Well, that concludes our program for today. As you can see, the voices of those 50 plus matter every day and in every way. To learn more about services for older adults in Montgomery County, please visit the Montgomery County Seniors website by visiting montgomerycountymd.gov/senior, or call the Senior Resource Line at 240-777-3000. And as always, thank you for watching 50 Plus in Montgomery County.